Hi, my name is Melanie, and I'm a clinical pharmacist in Allegheny Health Network. Today we're going to talk about how to use the Solostar insulin pen. The Solostar pen is a delivery device for Lantus, Toujeo, or Toujeo Max insulins, which are brand names for insulin glargine. It is used to treat diabetes. Lantus and Toujeo U100 Solostar pens can inject up to 80 units per dose and contain 300 units per pen. That is 100 units per milliliter and 3 milliliters in a pen. Toujeo Max U300 Solostar pens can inject up to 160 units per dose and contain 900 units per pen. That is 300 units per milliliter and 3 milliliters in one pen. It is injected subcutaneously or under the skin, in the abdomen, thighs, or back of the upper arms. It is administered 1 to 2 times daily without regard to meals. The Solostar pen contains a dose window, a dial, an injection button to inject the insulin, a pen cap that can be removed to see the insulin, and it should be clear and colorless. This should be checked before each dose. You will also need a pen needle, alcohol swabs, and a sharps container. You can use a detergent container, a metal can, or anything that is sharps proof. When you're ready to inject, remove the pen from the refrigerator for 1 to 2 hours so that it is not injected cold. This can be uncomfortable. Next, you'll wash your hands and remove the cap from the pen. Next, you'll swab the rubber seal of the pen with an alcohol swab. Next, you'll remove the paper seal from the pen needle. Twist the pen needle onto the pen until you feel some resistance. Remove the outer cap and save it for later. Remove the inner cap and throw this one away. Before each dose, it is important to prime the pen. To do this, you'll dial up to 2 units, and you'll see that in the dosing window. Hold the needle over a paper towel or a trash can. Press the button down to push insulin into the needle and out of the pen. You need to see the insulin coming out of the needle to know that the needle is primed. You may need to repeat this step until you see the insulin coming out of the tip of the pen. Now you're ready to inject. Swab the injection site with an alcohol swab. Next, dial up to your prescribed dose. Inject the pen at a right angle to the injection site. It needs to be flush against your skin. Press the button and hold it for 10 seconds to inject the dose. If you're injecting the Toujeo Max pen, you'll need to hold it for only 5 seconds. After 10 seconds, pull the needle straight out. Don't rub or press against the injection area. Put the outer cap back on the needle and pull the needle off the pen. Dispose of the needle in the sharps container. For the Solostar pen, the increments on the dial are 1 click for 1 unit. For the Solostar Max pens, the dial is 1 click for 2 units. Doses are usually increased by 10 to 15% until blood sugar is controlled. The most common side effects are hypoglycemia or low blood sugar. You may feel dizzy, shaky, sweaty, irritable, or even lose consciousness. If you're having low blood sugars less than 70 or frequent symptoms of low blood sugars, talk with your doctor. If you miss a dose of your long-acting insulin, you can take it when you remember it if you're still within the 12-hour window. Never double up on your doses. The pen should be stored in the refrigerator, not in the freezer. Once the pen is opened, you can store it at room temperature for up to 28 days for Lantus. Toujeo can last for 56 days or 8 weeks outside of the fridge once it's opened. You can also take it out of the refrigerator 1 to 2 hours before injecting for a more comfortable injection.